Now with a report on pain management, here's our reporter, Laura Windsor.
As the development of LifeWave technology progressed, Medical Director Dr. Steve Haltiwanger explains how they have discovered applications in the management of pain.
What I've seen is that this technology can have very rapid and effective pain control. And what we're doing is we've learned that the body's skin is electrically sensitive. And so there's different points on the skin that are more conductive than others that are known as acupuncture points. And when we have tested the patches with electronic diagnostic equipment, we can find that putting patches in proximity to each other, close together, we see that we can actually measure a change in skin potential or skin conductance. Both of them change. So what we see is we immediately change, in a sense, the field of the area, the electrical properties of the area, and it's very rapid. And so by putting the patches on an area of pain, we can do this, and it's a very, very rapid form of application, and people can have very immediate responses. So if somebody has a sprained ankle in a football game, you literally can put patches on, and sometimes in 30 to 40 seconds, they notice that the pain is just diminished significantly, sometimes gone.
Retired Army General Teddy Allen talked with us about the advantages of LifeWave technology as opposed to drugs for our fighting men and women.
The pain management is essential. Right now, all they've got are drugs that can manage the pain in active combat role. Even in training, we lost more people in training in the last couple of months than we have in the war, because training is realistic. And so we need it not only in peacetime, but also in wartime. And follow up with our veterans from all wars. Pain management is a major issue that we believe we can help.
42 years ago, Don Collins was severely wounded in combat in Vietnam. After enduring countless surgeries, he lived the last 4 decades on painkillers until he was exposed to this technology.
Within 3 minutes, I was from a 10 to a 1 with the patches. And being on drugs as long as I have every day for 42 years. I was taking morphine every 6 minutes. All I had to do was push the button. Every hour on the hour they bring in another cc of morphine. Every 2 hours they bring in another morphine, and they would also bring in 3 Percocets. Nothing was even scratching the surface as far as the pain. And if it wasn't for these LifeWave patches, I don't know how much longer I'd be here. They would have just have, the drugs were getting more and more and more, and you know, you were getting acclimated to them. LifeWave is the first thing in 42 years that has been able to stop the pain without a narcotic, and there's nothing that goes into the body. I mean, it's a miraculous. It's the most wonderful thing I've had in 42 years.
Last year, I made a donation of $100,000 of our product to the Rotary Club of Makati City in the Philippines, and Dr. Haltiwanger and I were able to train over 650 doctors and nurses in these 3 hospitals on how to use our pain relief technology. And this has been extremely rewarding to see the feedback that we've received from medical professionals. As a matter of fact, most of the comments that we get are that these patches do something that aren't possible, but yet the results speak for themselves. And those typical results are 50 to 100% relief of pain within 2 minutes. So this technology produces very dramatic results very quickly. The most personally rewarding part of what I do is to see people that have been suffering from chronic pain that now have pain relief without drugs. And I have witnessed thousands of people over the past 6 years experience pain relief, everything from arthritis, fibromyalgia, MS. We're not treating these diseases, of course, but we are providing a new method of pain management without having to use drugs. So this is the most exciting part of LifeWave to me.